What is sciatica? Sciatica is a word used to describe pain that travels along the path of the sciatic nerve. This nerve starts in your lower back, goes through your butt, and runs down the back of your leg all the way to your foot. You have a sciatic nerve on each side of your body, but sciatica usually affects just one leg. In this video, Bob, Brad, and Mike will be explaining what sciatica is, signs that you may have sciatica, how to tell if it's getting better or worse, how to tell if you're ready to begin exercises that could be harsh on the sciatic nerve, exercises you can do to help deal with your sciatic pain, and advanced stretches and exercises you can do in your everyday life to combat sciatica and live a healthy, fit, and pain-free life. Now, let's have the most famous physical therapist on the internet explain exactly what sciatica is.
It's all there. Okay, what is sciatica? Sciatica is a term for symptoms that arise from the sciatic nerve.
Right.
So that's, if you want to show Brad, so we got these little nerve roots coming out.
Oh, sure. Should we get right into that?
Yeah, why don't we get right in there right away?
I've always thought sciatica was a little bit of a misnomer, but everyone calls it that, and that's fine. Because it is the sciatic nerve. These nerves here on the lumbar spine, they're not chopped off like this. This is just a model, but they continue and they bundle into a bunch of nerves right where this pen goes through and then down the leg. And they have a specific map. This nerve goes to a part of your leg. This nerve goes to a different part of your leg. So when you have sciatica, it's typical that only a certain part of your leg, like I ask questions, is it in the front of your leg or in the back of your leg? Because that gives me information
as to which level it's at.
Which level it's at. And you don't really need to know that. As a therapist or a physician, that can be important, but don't worry about that now. But just so you understand, and the bulging disc right here is a good model of how disc can bulge out, and you can see where it puts pressure on that spinal nerve, and that nerve is going to be the one responsible for that pain, numbness, tingling, those typical symptoms that you have in the leg. Also, you could have a healthy disc where this, let's say we're looking at this one, but let's say the hole or the foramen where the nerve exits has become smaller, and it can be from bone spurs, it can be from scar tissue from an injury.
Degenerative changes with arthritis.
There you go, yep. As you age, and that nerve can get pinched because that hole is becoming smaller. Are you zoomed in, Mike? And sometimes that happens when you bend backwards. You can see that hole get smaller, and if typically people with stenosis, when they go forward, you can see it opens up. Now that's exaggerated there, that doesn't happen, but it gives you the idea. So if we look at that bulge, this model really does a nice dynamic description of it, display of it, I
representation?
should say. Representation, exactly.
Here we go.
As you may bend forward, and it pushes the internal content of the disc out, and it bulges and it pushes into the nerve. It's not exactly like this. This is a little bit exaggerated, but you get the idea. Now, if you go sideways, it can actually come out from the side. So either way, it doesn't matter. Well, it doesn't matter which way it goes out, but it will pinch the nerve, typically a peripheral nerve, which means it's going to go down one side. Very common. So we're going to focus a lot on what happens when a disc, because this is probably the most common cause of sciatica.
So the nerve can be compressed with the two methods that you mentioned, through the disc and also through the hole.
Right.
There's a third one. There's a piriformis muscle. It's a small little muscle on the back of your pelvis that goes to your hip, and that the nerve sometimes penetrates through it or goes underneath it.
Right.
And if that muscle gets irritated or tightens down over the nerve, it can send pain also down the leg.
Right.
So one thing you want to understand is that with sciatic pain, the more that it travels down the leg, the further it goes, the worse it's getting.
Right.
Without a doubt. If it's going all the way down to your foot, that's about as bad as it's going to get. If it starts coming up to the point where it's no longer in the foot and maybe no longer in the calf, it's just in the back of the thigh, that's better. So we're looking for that in the treatment. We're trying to get that pain to retreat, basically.
It goes down the leg and down into the foot. And then actually we could mention that if it gets worse than that, that's when your muscles turn off.
Right.
So if you can no longer lift up your toes like this, the nerve is at pinch. You really need to get to the doctor for sure and have him have it dressed professionally.
Yeah, we're going to say this throughout the video series, but we recommend that you definitely see a doctor at some point with sciatica, because it's just not something you want to mess around with.
Right.
You want to make sure you're properly diagnosed.
Now that we understand just what sciatica is, Bob and Brad will now explain how to gauge if you truly have sciatica.
Do you have sciatica? We got some self-tests here. All right, so it's highly recommended that you see a physician and have tests done by him or her to determine whether or not you have sciatica. But we always like to have you going in armed with knowledge. And these are some tests that you could do yourself to kind of maybe give you an indicator whether or not you have sciatica, or maybe it's something else like sciatica.
Right. Self-diagnosis, you're getting into, professionals can have a hard time diagnosing. Right. So if you're doing it yourself as a layperson, take this with
a grain of salt.
That you're just educating yourself and you're learning things here.
Right. Okay, we're going to start off with the first one. This is called a seated straight leg raise. So let's say I'm having, it doesn't matter because you can do it on both sides.
Sure.
Okay, so I'm going to go ahead. I'm going to test the left side first. I'm going to straighten the leg out. I'm going to pull my toe toward me, and I'm going to bend my neck down. Now, if that increases, I got stretching pain with that, but if that increases pain down your back into your leg,
right,
possibly could be sciatica.
Right. And this is nice. You should compare one leg to the other.
Should.
And if you feel a big difference in a different type of pain, the one to sciatica, that kind of stretching feels much different than a muscle stretch.
Right. That's a very good point, Brad, because I do feel stretching on both sides.
Yeah.
So the next one, this is going to be we're going to put a little compression on the spine. So first you're going to sit slouched. And then while you're sitting slouched, you're going to grab the seat pan and pull up on it. So what that's doing is, I'm putting pressure through the spine. When I do this, I want you to put your neck this way and see what the pain is like, and then put your neck this way. If it's worse this way and it's going down the leg, good possibility that you might have a disc problem.
This one, I want to give a precaution. If you sit down and you slouch and already the pain's getting worse and you're getting pain down the leg,
you don't need to do any further.
Don't do any pulling. Don't do the next thing. It means that you need to stop. Doesn't mean it's sciatica, but it's an indication. But certainly don't do anything more because we don't want to make things worse.
Right. Very good point, Brad. All right, this one is taking you off into kind of a different direction. I'm going to have you reach forward toward the floor. If you can go all the way down, go ahead, go all the way down. And if what we're looking for on this, does this decrease your pain? Okay. Let's say it does. Let's say the pain actually decreases. Then I want you to stand up. Sorry about that, Mike. I know I'm tall here. Reach overhead. And does that increase your pain?
Right.
And number 3, are you over 55? If you have yes to all of these, then you might have spinal stenosis.
Right. So in other words, you bend forward. Oh, it feels better.
Yeah.
And usually sitting feels better with stenosis.
Right. If it feels worse going forward like this, now again, we're looking at maybe more sciatica. But if you reach forward and it's better, you reach above and the pain is worse. And if you're over 55, which means arthritis and stuff has had a chance to develop and degenerative changes, you might have spinal stenosis.
Right. So with all of these, you're going to respect the pain. You don't want to push into the pain and get it bad. It's just, it's starting to hurt. That's enough to stop. You don't have to say a little bit more. Don't think no pain, no gain. That's absolutely not what we're
out for. No. And the final thing, this is a thing that is also often referred to as false sciatica, is the piriformis. Now, the piriformis is a small muscle in your pelvis.
It goes from here to your sacrum, and it goes right over the top of that the sciatic nerve.
Or the sciatic nerve might pierce through it.
Sure.
And if that muscle becomes irritated, it can send pain down your leg. So this is one test for the piriformis, possibly piriformis syndrome.
Sure.
Do you want to lay back, Brad, and show that? You got your mic issue here, huh?
We're all right. Okay, and you can do this in your bed or on a carpeted floor works well too. So if you go up and you bring your knee towards you and then across to the opposite knee, that actually puts a
opposite shoulder or
opposite shoulder. Yeah. Thank you, Bob. I'm not even talking properly, but that stretches the piriformis. If you do this and you compare one side to the other. And one side, let's say this is my piriformis that's tight or painful. Usually when you do this, you feel it there and it's tight and there's pain. And then you do the other leg and there's a big difference. It goes farther. There's no symptoms. All you feel is a normal stretch in that part of the buttock. Chances are, it's a good chance that you have piriformis syndrome.
Some piriformis
Not
involvement.
for sure, though.
Right.
It just means... it's more, and
probably going to do some more tests, and that's when you need to see the doctor. But again, that kind of gives you an indicator that, hey, it's something you could bring up to your physician and say,
right.
Hey, do I maybe have piriformis syndrome?
Right. I mean, I've had people do this comparison, and that made it better already.
Just by doing it.
Then it's clear it's piriformis, and then you just do the stretch more.
Doing the stretch, right.
You've now pinpointed that you do indeed have sciatica. How can you tell if your sciatica is getting better or worse?
So number one sign your sciatica is getting better or getting worse and what to look for. This is really important as you go through this program to know, am I getting better? Am I doing the right things or am I doing the wrong things and it's getting worse?
Right.
All right. This generally is, we're talking about sciatica here.
Right. Pain, numbness, tingling, any of those unusual symptoms that go down the leg. And I've had patients that come in and said, I don't think I'm getting any better. And I talk to them about what we're going to talk about. And I'm smiling because that's like, I know you're getting better, even though you think you're not because of this reason.
Right. So these are the symptoms that we're looking for: pain, numbness, tingling, weakness,
right,
and burning.
And I've had people describe it as like cold water running down their leg.
Changes in sensations.
Yep.
You can get the weirdest sensation when you get nerve pain,
right?
Nerve involvement, I should say.
Sure.
So these are two concepts that what we're talking about is centralization and probably peripheralization. But we'll explain about. We use tape on Brad to show what we're trying to accomplish here.
Right. So location of the symptoms is really critical to note. And as a therapist, I have a diagram and we draw it out so I have a good memory because my memory is not so good anymore. But on paper, it's good as can be.
That's right.
So
best memory is not as good as pale ink. Is that what it's something like that? All right. So right here, Brad's going to show this all represents pain. And I know they're not connected, and usually they are, pain is connected, but this will do a good representation. So back pain, if it's just in the back, that's not as bad as pain that has also spread down into the buttock.
And just to be clear, because we mentioned when Bob says pain, he's referring to all the symptoms. It could be the cold, the tingling, the numbness. Technically, you could say symptoms. I don't know if we need to get that technical.
Right. The overall concept here is the more it spreads out, the worse it's getting. So if it's just right here in the back, it's not as bad as if it spread out to the buttock. It's not as bad if it's spread out into the posterior thigh here, to the calf. And we even got one onto the foot here.
Which is not uncommon either.
Yeah, so it can be connected all the way down like that. The more it spreads out, the worse it's getting. The more it starts to retreat back into the back, the better it's getting. We call that centralization.
Right.
So let's say, we do some treatments, and the first day, you feel that's what we look generally for is the foot pain too, right? Foot tingling, numbness.
Yep.
Has that gotten any better? Is it any different? You go, yeah, it feels a little bit better. So we take this off. That's improved.
Right. Like I was saying, I've had people say, oh, my back is bothering me more. It hurts more here. Then I'll say, what about your foot pain? Oh, that's not there anymore. All that stuff is gone. And I'm starting to smile. It's like, okay, now we're going in the right direction, even though you are not aware of it.
And Brad makes a good point. Sometimes this pain can even get a little bit worse, but these are getting better. Let's say the calf pain goes away, but the back pain gets a slight bit worse. Still a great sign. We want to get rid of that pain that's traveling down the leg before we get rid of the pain in the back. That's generally the way to go. So you're going to keep moving right up here, and eventually it'll be into the back alone, and that's where we can then make it go away.
Right.
Now, conversely, it's getting worse. Let's say we're doing things, and you started off with pain just here and in the buttock, and all of a sudden you start feeling pain in the posterior thigh or the calf. That means things are getting worse.
Right.
The worst sign of all, by the way, is let's say this pain goes away, it gets better, but this pain gets worse.
Right. Yeah.
We're going in the wrong direction then. I mean, I don't want this pain to go away and this pain gets worse.
Right.
That means we're doing something wrong. So very simple. Let's get the pain retreating. Let's get it out of the leg. Let's get it out of the butt, purely into the back. Then it'll eventually go away once we get it up into there.
And we have a number of videos specifically showing there's specific, we call them directional exercises that are going to help centralize it.
So your sciatica is starting to improve. Bob and Brad will explain how to know if you're ready to begin exercises.
The title of this is actually want you to watch this video before doing any back or sciatica exercises. We feel like you need to understand why you're doing exercises. You will get better compliance and you'll get better understanding of the specifics of an exercise.
Right. We're going to show you some nice models to get a good visual. And when that happens, we find that patients really respond better. They comply better to the exercises. Everything rolls the right direction.
We're taking a piece of floss and we're trying to make the nerves move to the point where they actually can move without restriction. So we pull the nerve from one end while releasing it from another. And then we reverse it.
Do we want to give them a little show where the flossing occurs?
Sure, yeah.
I'll get in a little closer. So remember, we're going to look at the same nerve. I said this nerve actually ends up going all the way down to the leg, down to the ankle. And of course, it connects to the spinal cord, which eventually goes up to the head. And all that creates one, like a piece of dental floss, if you will. And when you move your leg in a certain direction, the nerve actually pulls one direction. So it goes this way, and you move your head and neck in another direction, and we'll go through this in another video. So this nerve ends up going back and forth. There may be scar tissue in there. There could be a number of things causing that nerve to be pinched and bound up, and the flossing can free that up. And we'll give you exactly education exactly how to do that technique.
Yep, and it can help actually desensitize the nerve so it's not so sensitive to pain.
Right.
We want to stretch body parts so as to allow you to get into proper positions when doing lifts or carrying stuff and such. A good example is that is like quite often when people, the normal person, when they bend over, they round out like this. Their back gets round.
Puts a lot of stress on that low back.
So you want to stretch your back enough that you can actually put an arch in there when you're bending.
Right.
And you can keep that arch. And that puts your back in a nice strengthened position. And that's the position we call that locked in position where the back is locked in.
Just good basic body mechanics that people aren't always aware of. And sometimes, like you said, they tighten up over the years, especially little older people, and they don't have that available. So we're going to show some specific stretches so that you can achieve that.
So get some movement so you can easily obtain those movements so that it's like putting your back in a cast. You know, your back is in a cast. It's not moving at all. So it's nice and stable. Right. Mm-hmm. We want to strengthen the muscles of the back and core, obviously, but we also want to improve the endurance. Because quite often, like especially if you have to stand for a while or lift for a while, or if you have to bend over for a while, you want to have the back to be able to hold that position for a long period of time.
Sure.
So we actually sometimes one of the exercises we recommend is a form of decompression or traction.
Right.
So with that, basically, very in simple terms, we're just trying to stretch and pull the bones apart.
Right. Traction has been around for many, many decades. It's not as used as widely now because surgery's gotten a lot easier.
Right.
I don't know if that's, if I can say that for sure, but we use it now. I've used it with patients. It's not our go-to thing, but it's certainly an option. You know, inversion tables is a form of traction.
Tables, and there's traction tables, and we got our hanging handles.
Right.
So
very simple.
Yeah, we'll have a whole video on that, but it can definitely give you some temporary relief. And by giving you some temporary relief, then you can do stuff to make it more permanent.
Right.
So now that you're ready to begin your exercises, we'll dive into some ways you can begin to treat your sciatic pain.
Why do we want you to walk? Walking to us is a quick win when you're trying to help heal your back. Because when you walk, you're going to have increased blood flow, increased synovial fluid. The endorphins are going to get built up. It's like a natural balm for your back.
Balm.
Like a balm, like a rub.
Oh, sure.
Yeah.
That's a good thing.
So,
but again, if walking does create pain for whatever reason, don't try and push through it.
No, not at all. And that's what we're trying to show you today, some things to try if you're having pain with walking.
Right.
So
yeah, we'll clarify that as we get through the video.
Okay. Number one, quite often, if you're having pain with walking, it might be because you're walking with poor posture. I see a lot of people like this out on the street, Brad.
Sure.
They're walking along and they're like this.
Yeah.
So what we're going to recommend is you actually take like a broom handle or stick, and Brad, you can demonstrate with the Booyah stick, just to see where you're at. I mean, to kind of use it as a locator to determine what your posture is like with walking.
Because you might think you're upright, and then you put something straight like the Booyah stick along your back, and if you're not touching here in between your shoulder blades and your head, you're not straight. You don't have good posture.
Yeah,
so
here, Brad is just making contact in one position, right on the mid-back.
Yep.
If it's in good position, he's going to make contact on the pelvis, mid-back, and head. So a common one is that people have that head forward, don't they, Brad?
Yeah. Let me get this hand so we can see that. So this is very common. And when the head goes forward, inherently, you lose a little bit on the lumbar, the low back as well. So when this starts to go forward, it hits the lumbar, which is going to directly increase that sciatica and low back pain. So everything works with each other with the human body. We're going to have exercises, a video on exercises to help maintain that, so your body awareness is better. But just walking, if you have a cane, if it's a short cane, too short, that's a problem. It's got to be higher. That's why we like a stick, or if you have a walking stick, that helps keep you up and reminds you to maintain that posture, upright, 3-point posture.
The first thing you want to do is try to keep your spine nice and neutral. We don't want to be too flexed over. I don't know who sits like this, but you want to show some flexion there?
Yeah. I mean, so we're talking about the low back. If we're flexed, it means we're leaning forward like this for whatever reason, not being aware of our spine posture. Or in a chair, maybe we're sitting like this or like this. Either way, the spine is flexed and it has more potential to have that bulge to go out and press into that nerve. So we're going to scoot our butt back into the chair, sit upright, and what works really well, and it doesn't cost anything except for take a pillow from the bed, put it vertical in a chair, and use that. And it helps your spine stay in that neutral position. It's comfortable, and it really works well.
Now, if you're sitting in a couch or recliner that's kind of wore out on the bottom, you can take a smaller throw pillow and put it behind your low back, and that may work as well.
That's right. Right in there, you know what I mean? Some of these older, even newer ones that aren't built well have a big hollow spot right above your belt. Fill it in with a pillow for good support.
Now, the next tip to try is to actually stretch out your hip flexor. Now, you're thinking, I have back pain. What the heck does that have to do with my hip? If your hip flexors are tight, they can essentially tilt your pelvis anteriorly or forward, and you can see the back is going to arch more, causing a different pattern and can cause some sciatic pain to happen. So what we want to do is stretch out these front hip flexor muscles and see if that can help.
There you go.
So there's numerous ways to stretch your hip flexors. Most people are uncomfortable kneeling down, but there's a simple way. If you lay off the edge of the bed, hopefully your mattress is firm. You can try it on the kitchen table or cupboard if you can get up there. But what you're going to do, if I'm going to stretch my left ones tight, I'm going to bring both knees to my chest. I'm going to drop this down in a straight line. Now I'm going to bend my knee on this side, bring the opposite knee to your chest, and you're just going to hold this for 30 seconds or so. You notice once I pull up, my hip comes up a little bit. That means I'm a little tight there. You're going to do one side, reset, and perform on the other side. You may notice one side is tighter than the other. Most commonly, if you're having sciatica and this is helping, the side is going to be tight. That your painful side.
There you go. So again, be careful with this one. If you're sciatica is flared up and it's uncomfortable to get in this position, you'll have to wait until things are feeling better and go to the next option.
Then one nice thing about this stretch for sciatica and stretching your hip flexor is your back is supported and it's in a neutral position already, so that's going to help. If you're doing a kneeling one, some people might arch their back too much and it could hurt. So there you go, just like that.
Yeah, that hurts my knee. That's why I don't like to do that one.
All right, tip number 3, we need to set up our props.
Okay, we'll take a break. Now, the next thing we need to address, particularly if you are in a car for an extended period of time, is your seated posture in your car. You'll know it's bad because when you drive, your sciatica gets worse, and it may be able to get corrected by simply changing the position of your back. Some people, and I've had many patients, I say, do you adjust your lumbar support? And they say, I don't even know if I have one. So we go out to their car, sure enough, they have a button, and you can adjust the lumbar support to get it in a comfortable position. You may not have that. You can simply use the pillow trick that we talked about before and use that in your car seat. Make sure you adjust your seat forward and backwards so it gets you in a comfortable position. It can make a tremendous difference while you're driving. This is a nice steering wheel.
Yeah, it's our new Bob and Brad steering wheel. Buy now.
All right, let's go on to the next option.
The next tip is to strengthen your hip abductors. These are your glute medius and minimus on the side of your hips here. What they do is keep you upright when you're walking. Some people that have back pain have weak hip abductors, so we're just going to strengthen them. You can do it many different ways. For beginners, we'll just stand and you can kick out to the side. Make sure to hold on to something if you have pain or you feel unsteady. I'm bending my knee on the stationary leg, so this hip abductor is working to keep me upright. We're going to do 10 to 15 reps, and then you're going to switch sides. Notice we're not rotating our toes out to the side because those are different muscle groups. Nice and straight, good posture. If that seems easy for you, you can take a loop band like this. You can take a cuff weight. You can take a big band like this and just put it around your hips, and then you got some resistance to make it harder because we want to progress over time, build up those hip abductors.
Big thing not to do that is a common mistake is this. The upper trunk needs to stay stable and upright, so we isolate those side muscles so that pelvis stays stationary, helping that back.
Now with strengthening, you can just do this every other day, Monday, Wednesday, Friday. Just do the strengthening exercise. Let them rest the other days and recover. What's our next one? Oh, walking with soft knees.
There you go.
Now this pertains to many other joints in your leg and even your low back. So most people commonly walk around with a heel strike, a straight leg like this. The impact forces are going to go ankle, knee, hip, low, back. If we can put a bend in the knee, some of the shock absorption will go into the muscles, so it can take pain off of your low back if you're experiencing it. So what we suggest is when you're at home, walk around barefoot or in slippers, maybe socks if you feel comfortable. Do your normal walking pattern like you always would, and place your hands on your buttock while you're doing it. Feel how much your glutes are or are not engaging. Then we want you to go on your tippy toes. Now feel how much your glutes are engaging. They should be activating a lot more this way, so that means you're doing it right. However, we're not going to walk around on our tippy toes all the time.
Yeah, this tippy toe thing, I don't go for it. Ain't no one's going to walk around
you
on their
can feel it, though, the
toes.
activation of your actual
I'm
muscles.
saying, yeah, just walk on your 4 feet like that so you're balanced.
So just make sure to have a nice soft bent knee. You can land slightly on your forefoot or with a flat foot in the house. You're going to take shorter steps, but if you're noticing your back pain is feeling a lot better, then this is the right step for you.
Right, and this is one of those things where we've had people, you change that, and they say, oh, walking's not so bad anymore. You'll know right away.
What's the next one?
Ooh,
glute strengthening.
glutes.
So some people have what is coined as gluteal amnesia, meaning their glutes aren't firing properly. Changing your walking pattern can help, but if you're still not feeling a lot, a way to isolate your glutes is to do some glute pumps. Now, you can do this in a standing position if you are not comfortable getting on your hands and knees like this, but if I'm doing my left one, I'm not going to do the full glute pump you commonly see. We're going to go somewhere in mid-range here, and we're going to do little oscillations, do 30 repetitions total. And then if you're not feeling much activation, say your hamstrings are kicking in too much, turn, and then we're going to do it this way. If you need to do 3 sets of 10, 2 sets of 15, do all 30 at once, whatever you're comfortable with. Just make sure to work both sides.
That's right. You can also do this one standing. I'll demonstrate here. Hands on a cupboard or a firm piece of furniture. Keep your back in that neutral position, not arched this way or rounded. And we'll do the same motion right here. Get that butt muscle firing. You'll feel it. Rotate it in. Again, 10 to 20 and up to 30 reps as you feel stronger. Okay, very good. Let's go to the next. This next stretch actually is going to open up that side, releasing that pressure from that disc bulging out, and you can do this. You can do it with a doorway if you're tall enough or not too tall. Mike will demonstrate it that way, and I'll demonstrate a way if that's not an option for you.
So you're going to lean into the door frame with your painful side going in. You could do this on a pull-up bar too if you happen to have one at home. My palm is going to face away from me. We'll say my left side is a painful one. I'm going to lean into the door to start, and then I'm slowly going to bend my knees, and I'm just going to kind of hang, but I still have pressure through my feet. This is going to decompress that spine and give you some pain relief if you're having an episode of pain. It's also going to stretch out all these muscles in your back that may be tight. So you're just going to hold this for about 30 seconds. You can do it on both sides if you want, but you mainly want to focus on the painful side.
That's right. If that does not work for you, you don't have a good handhold on the door, you're too tall or too short, you can simply take a booyah stick or just any kind of a broom or handle that's strong enough, maybe a piece of doweling or PVC pipe. You need a rubber tip. If you don't have that, simply put it on a shoe on your cupboard or chair so it does not slide, palm away. And again, I'm standing here, I'm leaning. That's putting the stretch right through here. You can see my shirt is starting to tighten up, and that's what's going to happen with your muscles. They're going to stretch, relax, and I'm bending my knees to get an adjustable or variable stretch on there. Again, it should feel good feeling that open up and allowing that bulge to get back in, or they call that reduction, and that feels good.
We should mention if you happen to be walking and you're having this pain and you know that helps, you can try just sticking your arm up in the air for a little bit while you're walking, then put it behind your head and then down at your side if you're having pain while walking.
Yeah, so you find yourself walking down the sidewalk like this and feeling good. And yes, people will talk.
Yeah, they always do.
Bob.
So this video is how to perform nerve flossing, which can help sciatica. This is a video that's part of a series of videos on sciatica. If you go to bobandbrad.com, our website, and go to the program section, you'll find the one on sciatica. And you may want to watch some of the videos prior to this one because you may not need to do this exercise if some of the other exercises are working.
Right. As a matter of fact, we kind of prefer those, check those out first. And like Bob said, if they work, this one's really
because the problem with this one is it can help, but it can make your pain worse. So you got to be very careful with it.
Right.
And we'll tell you how to do this so that to prevent you from getting a flare up and you being upset with us. So, all right, so we'll start off. This we're going to actually, what you do is floss the nerves just as you'd like to use floss to glide through your teeth and clean them. We're trying to pull the nerve from one end while releasing it from the other. What happens over time, when you do that, it actually can desensitize the nerve. So it's not as sensitive to pain.
Right.
So, in the end, what we're trying to do is decrease your pain.
Sure.
So,
right.
Again, you're going to do very careful. We're going to do just 10 repetitions. And after we do the 10, we're going to wait a day or so to see how the pain did.
Right. So
let's do the 10, and then we can talk more about that, Brad.
Sure, you bet.
So Brad's going to show from the side. Brad's got some tape on his ankle, which will show very nicely what the ankle is doing while we're doing this exercise. So we're assuming that on this time that the pain is on the left side. You just reverse it if the pain was on the right side. But what you're going to do is you're going to go ahead and extend the neck and the leg at the same time. So you're straightening the knee and putting the neck back at the same time while you're dorsiflexing the ankle.
So pulling the toes up, you can see the yellow tape as I pull.
Yeah.
That's dorsiflexion. And keep in mind your back is actually going to arch.
Yeah, be nice and straight.
Yeah, and look like you're looking up toward the ceiling behind you.
Yep. Arch. We're doing this very slow right now, but you're going to be doing this much faster. We wanted to show you. All right, then you go ahead and flex the neck, flex the knee, and push the foot toward the floor.
So you can see I'm pointing the toe down towards the floor. You have to make sure that the leg of the chair or wherever you're on doesn't get in the way. So
Yeah,
you have
that's
some
we
clearance.
forgot to mention that, Brad. You need to be on a high mat or bench or solid table, something where you can actually swing your leg underneath. Otherwise, this isn't going to work. You can't do
Right.
this on a chair where your foot is hitting the floor.
Right.
So it can be a little difficult to find the right surface for this. So that going up like that and going down like that, that's one repetition. And you're going to do 10 of those. And we'll show you about the speed that you want to do it at. So we'll start off with number 1, going back, straighten the knee, going down.
And when you go down, your back does slouch, actually.
Slouch a little bit, yeah. Coming up, going down.
Now, typically, the part where it's going to irritate the nerve, wouldn't you say, Bob, is going to be on the up
Right,
extension.
exactly.
And when you pull on a nerve that's sensitive, it can be painful, and you're going to feel it not in your ankle, but typically in the leg or up in the back even. So be very cautious. If it starts to hurt, don't push into it. Just
Right.
respect that and go the other direction.
Yeah, if you can only go up so high and before the pain really gets to be too much, then stop and head back down again.
Right. Again, this is, Bob said, this can really flare it up. So don't have the attitude, no pain, no gain, because that's not going to get you anywhere.
No, you won't get accustomed to this. This is not something that, over time you'll go, okay, if I just keep stretching, it'll get better. That's not how this works. So again, you can do repetitions. You're going to do 10 reps. Then you're going to wait a day. We can stop now, Brad.
Yep.
If there was no pain from this or it's slightly better, then you can do it once a day.
Right.
Throughout. If it did get actually worse,
Mm-hmm.
then I want you to wait 3 or 4 days or maybe a week and try it again. Before you try it again, though, what I want you to do before you do it is to actually lay on your stomach a little bit before you try it.
Okay.
If you can't lay flat, you can lay on pillows. We've done that before.
Where you put the pillows underneath.
right.
We did show that on a previous video.
Yeah, so you're going to lay for a couple minutes and then try the exercise.
Okay.
Same thing, do the 10 and see how it is the next day. If it's worse, you're going to say, you know what, I can't do this. I'm just going to stick with some of the other videos we have,
Right.
which we're going to talk about how to reduce your pain makers
Sure.
throughout the day.
Great job. Now let's continue on to various tips and tricks Bob, Brad, and Mike have given the viewers over the years to help with different everyday movements, how to make sure you don't flare up your sciatica again, and even how to get out of bed properly when dealing with sciatic pain.
The top 3 ways to apply traction or decompression to the spine, back pain, sciatica with equipment. So we have,
And you can do this at home. You can purchase this equipment, and we'll get into a little more detail on this.
right. So there's 3 pieces of equipment that we're going to show today. We're not going to show how the detail on how to use them. If you like, for example, we'll mention it when we go through it, where you can find it.
Sure.
And if enough of you say, hey, we'd rather have this easily found in the program, we could do a separate one of these.
Yeah, we'll
But
be happy to add that to
we
our
accommodate
program.
This is the Saunders traction table. Brad and I actually worked at the Saunders Clinic. Did you know that?
Oh, you did?
Yeah, I did as a student.
Oh, but 100 years ago.
Yeah, 100 years ago. And he was inventing the traction tables then.
Okay.
He didn't have a home unit then, but he had units for the clinic.
Sure.
So, Brad, why don't you just briefly tell what this is all about?
All right, so this actually folds up, and you can carry it around like a briefcase. It's hard to see now, but here's the hinge point that folds up. Open it up anyways, and there's some just 4 straps here that you get it in and get them snug. And then there's simply a little pneumatic pump that you pump. And right now, if you look real closely, right here where I'm pointing, you'll see this white plastic base is moving away from me, which is pulling my pelvis away from my
See how
trunk.
this gap is getting bigger? So the lower pelvis is being pulled away
Yeah.
from the upper spine.
So I can see right now I've got about 13 pounds of traction. So it's a nice meter. It's scientific that way. You can tell how much pressure you're putting on your back. It should feel good. If the symptoms in your leg are decreasing, you're gold. You know you're doing some good effects on your back in that regard. Again, this it's about at least a 10-minute video on details on how to set up on this, and there's a certain procedure on how long you're going to be on
Right.
the first day and so on and so forth.
Yeah, it's a nice unit. I sent it home with a patient. He loved it. I mean, I told him, it's kind of heavy to carry, and he's like, this isn't heavy. It wasn't.
Well, actually, like on the newer ones, there's wheels.
Oh, sure.
Yep, you can put on it so you can pull around like
a suitcase.
Yeah, like in the airport.
Yeah, sure. Okay, so I'll go to the second one, Mike, if you want to follow me over here. So these are invented by Bob and Brad.
I thought you meant click and clack.
No, we got the hanging handles here. So what's nice about these is that they're less expensive, of course. They're not that expensive. And you can actually you have to be able to secure these anchors into the wall, into a stud. Obviously, that's very important because you don't want them to pull out. But these handles can hold 275 pounds, I think. Each. So you can always have a 500-pound person hang on these pretty safely. So you can leave the handles off if you want in between treatment, and then when you're ready to treat, you just click them in place like this. And it's just, I've been using this. I've kind of been addicted to these now, Brad. I use these when I work at my computer, and I take my every 20 minutes. It just works great on posture. I get a little decompression of the spine. Now, mine are hanging a little bit higher, but you can actually put your legs out like this,
right?
Like this.
Well, Bob's like 6.5 foot tall, so
right.
You got to take that into perspective.
But I do this, and I feel my back cavitate or crack a little bit, and it's a great one to do.
It's wonderful for your shoulders. Again, posture. You're getting 3 different benefits from that also. So it's just not
even
just
working on your grip too.
Right.
So
4 benefits. Yep.
All right, we'll go to the third thing here. We got the teeter. Brad, go ahead.
So it's an inversion table. Teeter is the manufacturer of this one, which we really like the quality and how they work. And they have different grades. This is one of their higher end ones, and they have some other ones that they work as well. There's just a few different options on them. But lock your ankles in good and tight, and you have to adjust it so that when you lean back, you're in complete control. And just by the movement of your arms, so right now, obviously, there's no traction on my back. I'm level, very comfortable, and I can slowly go back, and I can feel the traction go through my back. I'm securely locked in my ankles, and I'm going to go all the way back, and you can totally invert. I typically say you don't need to.
It's set right now, so you can't, right?
Right.
Brad?
There's a strap underneath. I can't point to it because I'm moving.
It's right here. He's got it set so that he won't invert completely. Otherwise, he could completely be, what's the word? Butt over teacups, or how do they say?
Yeah, head over tea kettles.
Yeah.
But one way or another, I used to use one of these on a regular basis a number of years ago, and I never totally inverted it. And I felt I had plenty of traction at about 60 to 70 degrees where I am now. And I would hang out here for 2 to 3 minutes. Do not hang out for a long period of time, particularly initially. I did that my first time, and I got a headache for the rest of the night. So too much too soon. You have to be cautious.
Again, we have a whole video on this one too. If you go to Bob and Brad, just type in inversion table, and it'll pop up, and where we went into better detail of how to use it, when not to use it. We're going to show you how to make the bed when you have back pain or sciatica. The first thing you should keep in mind, you have to determine whether or not this is a vital task in your day.
Right.
Because honestly, when you're trying to calm things down, you're trying to avoid the pain makers in your life, you want to avoid things that you don't necessarily have to do. Now, the bed, I don't know what kind of person you are, but for a lot of people, you don't have to make it. You know what I mean? It's still going to be there the next day.
I have a sister-in-law that has to make it. I'm sure. I never asked her, but I'm sure. Myself, my wife can do it.
Yeah.
But actually, it's not that big a deal. If it's a matter of getting your back or your sciatica flared up or not,
right?
That's what you got to keep in mind.
You want to avoid it. It's not worthwhile doing, because actually making the bed is actually hard on your back, especially if you do it incorrectly. So the first thing you want to do is you want to make sure, no matter what you're doing with the bed, is that you're avoiding that rounded out slouch position, because a lot of people do this.
Right.
They're rounded out. Their back it's causing the back to bulge, the disc to actually bulge or herniate more.
Right.
So, Brad, do you want to give me a booyah stick?
Absolutely, Bob.
So there we go.
Sorry.
Hands today. So as Brad and I have mentioned many times on a lot of the other videos, is that you want to be in a position where your back is aligned like this, the locked in position.
Right.
So you're going to want to have 3 points of contact if you think about it. Not that you're going to use a stick like this, but this is what you want to visualize.
Here.
Yeah, 3 points of contact. And all the movement is coming from the hips and the knees. The movement's not coming from the back. The back's locked in like it's in a cast.
Right, because here's the injured area with the sciatica, even though you feel it down your leg, this is what we want to keep in that locked in position so you don't, injure it, re-injure it, or make it worse.
Right. So it's whether you're bending forward or you're bending down. Either way, you want to keep it in that locked in position. So now I visualize that, the stick's in place.
Yeah.
And I'm leaning over the bed when I'm making it. The other thing is, as much as possible, when you're working with the bed, is you can either put your leg up like this,
Sure.
this takes some stress off the back, makes it easier to keep it straight.
Yep.
Or just putting your hand on the bed can actually unweight the spine. This is a big difference.
One hand you'll be working with, the other hand will be resting or taking weight off of your back.
Now, you can also put the hand on your knee.
Sure.
This works just as well. Also, we've seen it where people, like when they're working in the garden, stuff like that, they put their elbow on the knee.
Right. Yep.
But look how they're really keeping the
Yep,
back
keep
straight.
that.
So, but the hand on the knee even here works here as you work on the bed and lean forward here. Again, it doesn't take very long for your back to get sore when you're bending forward like this.
Right.
I mean, I think everybody sees that. So anything else we want to add to this, Brad? I think that's about it, right? I said the only thing you could maybe tighten up your stomach a little bit too when you're doing this.
Right. And we do cover that clearly on another video in the series, but it's a good to mention. Good.
Right. That's always a good reminder that
Yep.
when you lean forward, go ahead and tighten up the abdomen because that kind of splints the spine too.
Right.
So
Get your posture, arch the back, lock it in, tighten it up, and then work your job as needed.
yeah. So again, number one takeaway is avoid making the bed if possible.
Right.
So,
There you go.
we're just going to talk about how to load the dishwasher versus doing dishes with back pain or sciatica.
Right.
So we'll talk about the dishwasher first, and then we'll show what you do on the sink.
Right.
If you're going to go ahead and use the sink. So this is another one of these situations where we'd actually prefer to have someone else do this for you.
Right. Avoid it because you're going to be bending forward. If you forget about doing your good body mechanics, or if you're in a flare up, it's going to be tough.
Yeah. Anytime you flare up the back, it takes a little bit longer for the nerves to calm down. So we're
Right.
trying to avoid those pain makers. But let's say you're stuck and you got to do it. So we're going to borrow your imaginations here.
We don't have a dishwasher
Yep.
in our studio.
So we're going to go ahead and this is going to be our dishwasher. Now, the problem with this is there's almost no way you can open up the door and keep your back straight without turning and bending.
Right.
So what we're going to need to do is have you get down on your knees. Do you mind if I do this, Brad?
Oh, yeah.
So
Now, we realize probably most dishwashers flop open
out that
this way, but you'll just bear with us.
Yeah.
The concept's the same.
a pillow on the floor often helps.
Right.
It's best if you get down on both knees, actually.
Sure.
And use your countertop to help lower yourself down.
Mhm.
So we're going to get down like this. We'll open our little dishwasher up here. Now, what I would do is I would put the dirty dishes up on the counter first.
Right. Get it organized.
Yeah, get it all organized, all ready to go. You're going to pull out we're going to really push your imaginations to the limit here. So I'm pulling out the rack.
Now, one thing I do want to mention is for the upper rack, when you pull that out, you may be able to do that standing. So
Good point.
Put all the heavier dishes on the upper rack that fit, and then the lighter ones would go in the bottom. And actually, what you could do is do 2 loads and just use the upper rack, and
Sure.
that's an option.
That's an option too. Not efficient, and maybe cost you a little more. But
Right.
hey, you gotta do what you have to do when you have back pain.
Right.
So you're in this position now. You're in a good position to help load the dishwasher. Now, can you can't put plastic cups and stuff in the lower rack, can you?
I do.
Oh well,
I don't.
my wife keeps yelling at me. I can't.
Well, I don't know. I haven't read the directions that thoroughly, but they come out fine and they're not melted.
Well,
or
we'll have
nothing.
somebody make comments on that if that's wrong. But you can see now I can keep my back supported. I'm holding on to the
Yeah.
counter. I'm staying in a straight position the entire time.
Right.
And then we can push it in. Now, reverse is you're going to want to do the same thing. When it's all clean, you're going to want to get down in the same position, pull it out, and then put stuff on the counter.
Yep.
You don't want to do one thing at a time. You'll stand up, you get down, get everything all lined up here and get ready to go. But this is the safe way. This is actually similar to actually loading doing laundry.
Sure, right.
So
if you have knee problems and you're unable to get down to your knees like this, I would strongly suggest there's always the old-fashioned way, do them in the sink.
And that's what we're going to talk about next.
Oh,
Greg,
good.
When we
Good.
talk about that.
Excellent.
So when you're doing it in the sink, one thing that we used to recommend, we did a back program when I worked at Mayo, Brad, and
Sure.
we'd recommend getting 2 tubs. So you take 1 tub and to raise it up a little bit, especially if you're tall like me.
Right.
Now your height, maybe you're fine with a sink. You're not leaning over as much.
Well,
I
it
don't know.
still helps. Even a few inches makes a big difference.
So what you do is you take one of the tubs and put it upside down,
Yep.
and then put the other tub on top of it.
So we're talking about those plastic tubs.
The plastic
They
tubs.
don't cost that much. You can get them at most box stores
Yeah.
or online.
For hardly anything now.
Right.
So you fill that top tub up then with water, and you'll feel that'll be raised then.
Right.
So
As long as it's steady, because you don't want to have it slipping
it's
off.
steady, and you got to be able to, a lot of times you have 2 sinks so you can pour it off into the other sink.
Right.
Otherwise it's
Right.
a whole thing.
Yeah. So you got to
So-
use your ingenuity a little bit with that.
The other thing that helps sometimes with some people with some back problems, it helps for them to open the lower cabinet.
Mm-hmm.
Do you want to show that,
Oh.
Brad?
Right. So if I was doing my dishes here and wash, you put on, open this up so you can put 1 foot up, and then every few minutes you can change position. And a lot of times that can relieve stress on your back, and you'll feel it right away, immediately as you shift.
And it allows you to get a little bit closer to the dishes. Too,
Exactly.
so it
That's a
makes it
good
little bit
point.
easier. So
Right.
again, with all this, you want to make sure the back's in the locked-in position, which means you have kind of an arch in your back.
Yeah.
You might have to tighten up your abdomen at times. You may have to adjust the arch in your back
Sure.
if you're having troubles, but do it safely so you don't have any pain when you're doing the dishes.
Yep.
We're going to talk about how to stand correctly and pain-free with a herniated disc, sciatica, and back pain.
They're all related.
They're all related, yes. So let's jump right into it, Brad. So these are some quick adjustments for you to try. The big thing we don't want you doing, we're going to hold on to that, Brad, is we don't want you to basically just settle in. And that's what happens. You're trying to hang on your ligaments to some extent, and you start rounding out your upper back. Your lower back kind of slides forward because you're hanging on the ligaments of your hips.
Sure.
And your knees get locked. So you're kind of like this. Yep.
Yep.
And this is what I used to stand this way, believe it or not. So one, you want to bring your hips back and your shoulders forward. So one way to do that is to make sure you're not locking your knees.
Mm-hmm.
So you want to bend your knees a little bit and putting 1 foot right in front of the other. That helps. It makes it harder to lean back.
Sure.
You know what I mean? It makes you more of an active position,
Yep.
more of like an athletic position. So the other thing, I got an exercise here to try, Brad. You can actually do the butterfly exercise.
Okay.
So you take your hands and put them behind your neck, and you raise your elbows up, and then you open the wings of the butterfly, tuck your chin in. When we say tuck your chin in, we mean not going back like this, not going down like this, just tucking it back, and then lower the arms. And that's right where your shoulders and neck and ears all should be aligned here.
So yeah, it's a way to get you in proper alignment without looking in the mirror.
Yeah, it's a good check, checkup that you can, every so often just see where you're at and pull things back. Another thing that you can do is you can go ahead and take your arms, and because everybody tends to want to, again, round out after a while.
Sure.
You can actually stand with your arms behind you like this, and one hand grabbing the other wrist. And that's going to just keep you somewhat straight, keep the shoulders back over a long period of time. So you 1 foot in front of the other, knees unlocked, put the arms back like this, and you're going to find yourself standing fairly straight.
Sure. And I think one thing that I have people do, include myself, is work with your abdominals. If you tighten up your abdominal muscles slightly, that can change the position of your pelvis, which can change your back position, which can, and you'll find out just by doing that, that may change your back pain from, oh, it hurts a little bit, tighten it up, oh, the pain's better.
Yeah, very good point, Brad. You want to mess around with that. See what the comfortable position is for your pelvis.
That's probably one of the hardest things for me to teach patients.
It is hard to understand.
Because a lot of people don't have real good body awareness if they don't have a history of being in athletics or dance or something like that. But that is one thing that you can work on.
Sometimes we often start that on the bed, working on your pelvis and then work to that. Now, you can also use like a walking stick or the Booyah stick, especially if you're going to stand for a while. You're going to find that it just, a cane tends to lean over, or a walker you tend to lean over on. But with a walking stick like this, you grab up and it actually is easier for you to stay in an upright position.
Right. Typically, these are 5 foot long, so anything that is that long, which walking sticks typically are much higher than a cane. And again, it gives you something, and then you can kind of shift your weight, which can be very helpful for back pain too. Are we going to talk about putting one foot up?
You could, sure. You want a stool? I'll grab a stool.
Yeah, this is one of those things like we'll talk about a lot of times with people. If standing still, and even if you're doing some of these things that it still bothers your back, like doing dishes, if you open up the cupboard door and you shift your weight from one foot to the other, that can relieve pain. And you'll be this way for, a few minutes, 5 minutes, and then you shift again this way or this position. It gives you 3 positions, which varies that static stress on your back.
Yeah, I found out that was really true, Brad, when I used to stand at track meets. And I would just get my foot up for a while and kind of just even stretch a little bit like this. It seemed like it made a big difference. So
Today we're going to talk about best sleeping position for back pain, sciatica, leg pain. We've already done one on basically the kind of the waist up, more the neck,
the upper trunk,
and arm. So I'll link that at the end. If you can wait all the way till the end, I'll show the link to that.
Sure.
See how I did that, Brad?
Yeah, you're working on it.
Okay, today these are a lot of great tips, so you want to pay attention, and we got a lot of them. So let's start off with, first off, you want to make sure your back is lined up well when you're sleeping. You want to make sure you're not in a rounded out position like this. Mm-hmm. So you want to make sure your mattress isn't saggy.
Right. If you got a big hole in it, it's a really soft mattress, and it's used, it's a number of years old.
Right.
You probably know if you have it.
And so if you want to see if it's going to feel a lot better to get a firmer mattress or a new mattress, you might take your mattress and put it on the floor, because that would kind of give it a solid.
Right.
Or you can do what my wife and I did when we first were married and we didn't have money, is we took a piece of plywood and we put it between the box spring and the mattress, and that took the sag out of it.
But you did put the mattress back on.
We did put the mattress back on, and we didn't break the box. But that worked out really good, actually.
It's a family show, Bob.
Yeah, okay. All right, the next thing you may want to try is when you're sleeping on your back, one thing that some people have recommended, and Mulligan was one of them again, Brian Mulligan, is to actually take a sheet, because you want to keep, again, the back in the neutral position. You don't want it to round out like this. So for some people, especially if they're having back pain and in the throes of back pain, try this.
Yep.
So you take a long sheet and you roll it up like this, and you start in the front like this. I don't want to get my microphone. And then you go around like this, and it actually doubled up in the back a little bit. Do you see that, Brad?
The whole idea is you want to make some cushion here to take up that space to support that low back so it doesn't go into that hole, if you will.
Right, keeps the arch.
Right.
And so you can pin this in place or tape it in place.
Right.
So let me show you here. When I'm laying on my back, it provides my back some support.
Right.
But beyond that even is when I lay on my side. If you especially have wide shoulders and wide hips, the back is going to sag down like this.
When you get that sag, there's going to be a hollow spot there.
Right. If this isn't in place, this actually keeps the back aligned nice and straight while you're in this position.
Sure.
So
now, the thing about sheets is they're not very soft. If you actually, they make them and they work, I think, a lot better in a sheet. But you can You can start with this, and if it works out well, then our camera woman. Come on, Lonnie. Lonnie, come on down to The Price is Right. Yeah. This
is tied in place.
So, yeah, this is actually, can you lift that arm up? This is a McKenzie lumbar, what do they call lumbar sleep roll.
Oh, sleep roll.
Sleep roll,
Okay,
exactly.
gotcha.
And we got it wrapped around. You tie it in the front like this. It does not need to be in the front like the sheet does, just on the sides and the back. Why don't you lay down with Lonnie? And Lonnie had never tried one of these before, and she laid down with it just a little bit ago, and she immediately said, what did you say?
Good.
Good.
So then you can roll on your side, Lonnie. Yep. And the same thing, again, keeps your back nice and straight when she's on her side.
Right. It fills in that hollow spot to support that lumbar spine.
You can actually do that even if you sleep on your side all the time, and you could actually even just put a small pillow there.
Sure.
I mean, that would do the job,
something that's
too.
gonna, you'll know, because if it's right size, it's gonna feel good.
Thanks, Lonnie. She likes it so much she's going to wear it all day, she said. So she'll be the talk of the town. All right. And another thing that works out quite well, especially for people who are having kind of severe back pain, is to sleep on your back and to put a pillow underneath your legs.
Sure.
Or a wedge.
Yep.
So should we do the pillow first?
Sure.
So I'm sleeping on my back. I would have a pillow here too, but
we're gonna give you the deluxe.
You might need it under my legs though. Oh, there we go. Yeah.
Yeah, I knew you'd like that.
So a pillow underneath the legs, it takes off some of the hip flexors aren't pulling on the back now like they were, and so you're not getting as much stress in your back. It would be better probably with two.
Depends on how thick your pillow is, how big your body is. Bob's a tall guy, he probably needs two.
I need two, and that actually does feel really good, Brian.
Right.
Really does take some of the stress off the back. But let's show the deluxe position here, Brad.
Right. And this is something I use a lot with patients, and most of them are very happy when you put one of these leg wedges.
I was really shocked about this, how good this feels.
Right.
It's like you said, even if you support the legs like this, this does not feel nearly as good as if he shoves that.
Right up against the buttocks.
Up the buttocks.
It touches the hamstrings, and there's something about that helps relax.
Oh, it does. This is very comfortable, back pain or no back pain. And this is going to stop you from sleeping on your side, too.
Yeah, exactly, yeah.
So
I have one of these at home, and when I have a back problem, if I'm out working in the yard or doing some stuff that I shouldn't be doing, I got a backache, I use this, I put a cold pack under my bed, under my back, and then I fall asleep.
Yeah.
I wake up later and take the cold pack out, and sometimes I'll take this out, and sometimes I won't.
And if you want to try to simulate that at home without one of the wedges, you could lay on the floor, put your feet up on the couch. It wouldn't be quite the same, but it would still take some of the stress off the back.
Right.
And you could put your cold pack, or you could put a hot pack, I guess, on there too.
Sure, yeah, some people prefer that.
Cold packs, I think, are quite often better. When you're sleeping on your side, Brad, do you need that yet? Or?
Well, I was just going to say, if you want there, it's called a leg wedge, and just Google leg wedge, and you'll see many pictures of them. You can buy them.
Yeah, we actually did a video on just that alone.
We did. Mm-hmm.
All right, when you're sleeping on your side, what you may want to do is actually use a pillow between the legs.
Sure.
This is what we call the stacked position. So my legs are stacked on top of each other, and the pillow, again, helps keep the spine aligned and stops the spine from rotating.
Sure.
So it works really well with that. If you're a person that likes to sleep with the leg a little bit forward, then you may want to actually use two pillows and get it up a little bit higher like that.
Then you got no pillow for your head, Bob.
I know, that's a problem.
You got to go buy some more pillows.
Yeah, you're going to need lots of pillows.
The other thing about this is it takes stress off the hip.
Yes, it does.
If you've got hip bursitis or hip arthritis, this can
Very good point, Brad. And what's nice about this, because on the upper extremity, we talked about giving the arm support like this. You actually can flip around like this, Brad. I mean, it's not that hard to do. You can switch positions.
And this way, like if my wife is mad at me and she's not sleeping in bed with me, then I got something to hold on to.
Oh, isn't that sweet? And I think there's a lot of nights like that. All right. We did all that. Oh, the one thing I was going to mention is, and I don't know why this is, but Brad confirmed this too. There's a lot of people that when they're having, in the throes of back pain and they're really having a lot of back pain, they sleep in a recliner.
Yeah.
I've had people that, and the thing we want to remind you, if you're sleeping in a recliner, I don't want you sleeping kind of in a humped position like this. Put a throw pillow or something behind your back so you're nice and straight, and then back like this to the recliner.
Right. Yeah, back it up as far as you can go. Have that lumbar support there. I don't feel confident in saying sleep in your recliner, but there are people, they're going to sleep in the recliner.
And that's what I mean. There must be some merit to it, because I've had people a lot of people, and then they probably discover it because they aren't able to sleep, so they get up and watch TV, and then they find out they can sleep in the recliner. Right. I've had people even like years later that had to continue to sleep in the recliner because it brings on pain if they don't. Yeah. So there's not much you can do if that's the issue.
Yeah, I'm not going to advocate it though, unless that's what works, I guess.
All right. The final thing is, we talked about, is it okay for you to sleep on your stomach? You know, a lot of people think, oh, you can't sleep on your stomach. It puts your back in too much of a sway back. Mm-hmm. That's usually not the case. Quite often, if you've been sleeping on your stomach and you don't have back pain, I'd go ahead and keep doing it. Right. Wouldn't you, Brad?
Yeah, we're always concerned about the neck because your head is twisted one way or another. So we oftentimes say, avoid sleeping on your stomach because of the neck, not so much the back. Right. Unless you got a big saggy bed and you're sleeping in a kind of a hole in reverse, maybe that would be undesirable. But
you might try sleeping with a pillow underneath your stomach.
Sure.
You know, if you're having a lot of back pain, sometimes it's weird the positions that help you.
Right. Exactly. So, sleeping on the floor. I've had people with back pain sleep on the floor because it's a firm surface, gets that spine in line. And I had this one woman, she slept on the floor for over a month, and she felt better sleeping on the floor than in her bed.
Did she use a foam mattress or anything?
No, it was carpeted.
It was carpeted?
Yeah, it was carpeted floor.
Yeah, I know. Mulligan recommended that too, to go ahead and sleep on the floor.
Mackenzie will work with that sometimes too. Mike, it is your turn to show your favorite sleeping positions. Go ahead.
So I just went from what we had in the previous video of my favorite sleeping position, and one I use frequently is the pillow between the knees because it helps keep me in a nice posture. I like to roll around at night, back, side, stomach. This normally keeps me in a side position. If the pillow is not there and I'm having back pain for some reason, which has happened a few times in my life, I end up rotating like this, and then I'm sleeping like this, and my spine is all twisted, and it does not feel good when I wake up. So having that pillow there just helps me prevent from even if I roll a little bit, like you get stuck here, and it keeps my back more aligned and feeling good.
Right. Did you wear your shoes?
I do, yeah. I wore this exact outfit and my microphone. There's cameras too. It's kind of weird.
Well, that makes it efficient in the morning. All right. Well, that is nice. Now you're going to find out I have a little more involved because I don't know if it's because of my age or what. Yeah, I guess that may be something. But
how many pillows do you want here? 20?
Yeah, get them all on the sleep wedge too. But actually, just last night, this is what I used. Sleeping on my side because my shoulders are a little more sensitive for whatever reason, maybe because I swim too much. I take a pillow right here in front of me and I'll go like this or like this, and I'll get my top arm comfortable. This arm I'll pull out. If I go like this and sleep right on the shoulder, it's uncomfortable. So there, and then can I have where's another pillow? I can't reach it.
I'm glad you're talking about your shoulder, but this is a back pain video, Brad.
Well, it all works together. Believe me, because if I can't sleep comfortably, my back
I also hug a pillow too, by the way.
If I put a pillow behind my back, it keeps me in a position. Otherwise, I start rolling around. Then I get that twist in my back, and that's uncomfortable. But like Mike as well, I will use the pillow between the knees, which is comfortable. And on my back, usually I'm very comfortable on my back. But there are some times if I do have a sore back because I did something silly out working in the lawn or something of that nature, I used to take pillows like this, like that. And if I had a really sore back, I would put a cold pack underneath my back to start. I wouldn't fall asleep with the cold pack on usually. Take that out, put it on the floor and fall asleep. And then later on in the night after I'm falling asleep and things are going good, I oftentimes will get this off because I'll go to my side and sleep. The other thing that works really well, I have one of these, and there just works better than pillows. And fall asleep like this, sometimes with the cold pack. I've been doing pretty good with that. I've been behaving well. And then again, if you're rolling around, it does get in the way. My back will be fine after I fall asleep and things settle down, and I can roll a little bit right to left. And
Does
of
your
course,
poor wife have any pillows, or you just use
well,
ours, too?
sometimes I use her too. She
Oh.
pull her up so I can.
She's a pillow.
Well, no, she's very comfortable anyways. Hope she doesn't see this episode, but anyways.
The title of the program is How to Put on Socks and Shoes with Back Pain and or Sciatica. When you're trying to put it on your shoes and socks, one of the main goals that we're trying to do is stop your back from going into the C position, which is, if we show on the spine here, wow, I'm really making a lot of noise here. This is the C position. So when you're in that rounded out position, this is a bad position for most back pain issues.
Right.
Definitely for sciatica.
Right. If you got a disc issue, that's more than likely going to make it a worse disc issue.
So we're trying to keep you as straight as possible. And sometimes we actually use the Booyah stick for people to, as a good visualization, especially when sitting, Brad. I think this works out great. So if you sit down, and if you were to have a stick along here, you got 3 points of contact.
Here, and down at the belt line. They're touching.
When I'm trying to put on my shoes, I'm trying to keep those 3 points of contact. Now, obviously, you're not going to have a stick here, but it's a good reminder of visualization.
Right, and we're actually going to show you options so you don't even have to bend like that with the straight
Let's
back.
go with the first one, Brad. So putting your pants on or your socks and shoes even on in bed is a thing to try.
Yeah, because the whole goal is
Why don't you take your shoes off first, Brad? Because you got slippies, don't you?
Yeah, these are handy. It's a nice option if you do have sciatica to have shoes on and off. To keep your back supported and straight while you put your pants on, as opposed to in a seated position where you lean forward and irritate that disc. This is much better. So obviously, I'm not going to show my body off and take my real pants on and off. We're just going to go over the top.
Show his body off.
Well, Bob, I'm trying to.
It's nice to have some false pride there. So,
but yeah,
you can see how he kept his back.
Yeah, my back is all straight.
Yeah, all supported.
There you go. And then now, once I get them up like this, I'm going to tighten up my core and slowly keep that back straight and slowly come up. And
that's why we have you work on bridging sometimes. Now, Brad, if you were to put your shoes on in bed, how would you do that?
Oh, that's a good question. So with this, it's really nice to be able to have enough flexibility in your hips to do the figure 4 position, which is here.
Got the wrong shoe there,
Yeah,
Brad.
the wrong shoe. That's all right. Kids do it all the time.
That's all right.
Well, I would have the shoe up here. I'd have my grabber, but Bob's got my grabber. There you go. Thank you. Yep. So then you can do this. And then, of course, in another video, we covered how to do the, do the log rolling, keep your back straight and tighten up the stomach, go up. Everything is nice and stable and straight. And there we go.
All right,
Don't
Brad.
I look like something from Hollywood?
Now you need to take those pants off, Brad, because I need them. So anyway, we're going to do it in a chair, which is a little more difficult, I have to admit, because just as soon as you bend forward, and especially for a tall person like me with long legs, it's just a lot more difficult. But we'll show you. We can try. So the first thing you can do is straighten out the pants and get them all ready.
Right.
And you can just feed your foot into it down here while I'm keeping my back straight. I'm even leaning up against the support of the back of the chair while I'm doing this. Pull it up. Same thing. You got to kind of feed it back down there. If you have troubles, you might be able to use a reacher. And
it's got a little grabber thing you can squeeze. And
they call them reachers, right? I believe so.
Okay.
So, and you can feed it on. These are real handy, especially for people with back pain, because they can pick stuff up without you bending forward.
Right.
It works out really well for that.
And they're not that expensive.
Right. Again, that's one thing why we like you to work on hip range of motion, because that can save your back. The more range you have in your hip, the less you have to move in your back. And if you can do this like figure 4, now you're able to get the pant leg on very easily,
right?
As opposed to if you're not able to lean forward, and then you're going to have to maybe use something like that. Now,
for putting your shoes on, they do have long-handled shoe horns.
Yeah, those are handy.
They are very handy because you can get your shoe over here. I'm going to pull this one over, and the shoe horn. I'm going to get this. I have these really tight too, the laces, and you can see I slide it right in there.
Yep.
Now this might be cheating to some extent because these shoes were these are special shoes called Zeba shoes, Z-E-B-A, and they're designed to slip on. They're really a cool design. I've never seen anything like this before. So if you're going to come up to these, now I have, again, these are set very tight. My shoelaces.
Yep.
So you put them in here, and now watch how this collapses back there. See how it collapses?
Right here.
But it's got like a little shelf on the top. And I go further, and it pops right up. It doesn't squish the back down forever. You know, it stays in place.
Right.
And now my shoe is on tight. Now for taking it off, they actually have a little bit of a ledge back here, and I can grab with my toe, and it pulls it right off. Were you able to catch that, Mike? Or do you want me to do it again? Okay,
Beautiful.
We're good. So these are not a bad investment. We're actually trying these with your mom.
Right.
Because that's a big issue with her.
She didn't have a back problem, but she's older and she has a problem reaching over. It's a safety issue. You don't want her to fall out of a chair.
Now, if you don't want to invest in the shoes, you can get elastic. You want to grab those elastic shoelaces?
Oh, yeah.
They do have elastic shoelaces that you tie, you tie the shoe, and they'll allow it to get your foot in there, expand to get your foot in there. So it's a lot easier using a long-handled shoe horn and elastic shoelaces.
Yeah.
You can quite often get them on.
Once you get them in, you tie them. You can tie a good knot on there, and you never have to tie them again. With the elastic laces.
Right, so that's another option. Anything else we want to cover, Brad? I think that's the ideas of what we can try when you're, the final thing is if you can't do it, if you have a spouse or a friend at home, you may have to have them put them on for you.
Right.
Especially when you're in the throes of back pain.
Yep, when it's severe.
Sciatica. It's really important that you do this correctly. Otherwise, you're kind of injuring your back each time getting up.
It's one of those things you don't think about, but once we show you, it'll make sense.
Yeah, we're trying to decrease the pain makers in your day, and this is part of it. This is especially true in the morning. All night long, we've mentioned this in other videos, all night long your discs are filling up with fluid. They're imbibing fluid, as you would say, Brad.
Yes.
And that means with increased fluid, there's more likelihood you could have damage from the bulging disc or herniated disc.
Right, because there's more pressure in there, and so getting up from a chair improperly increases the pressure further, causing risk for more injury.
So the first thing you want to do is when you're getting out of bed in the morning, you want to make sure that you get out with the back straight. So the big thing that we want to carry over through everything we mentioned today is first, you don't want to do it incorrect, which let me show an incorrect way to get out of bed or out of a chair is you go ahead and just lean forward like this, round out the back.
Right.
And then usually you got to really get your nose over your toes to get up out of the bed or out of the chair, and your back really rounds out.
Right. And most people aren't aware of this, but as therapists, we're extremely aware of it. And those are times when people say that's when their back hurts. Oftentimes, maybe not here, but the straightening up part becomes very painful, and then they kind of walk and it improves. But that's all part of that disc becoming deranged, if you will. That's the term that McKenzie uses.
We just want to decrease the amount of times you're having stress on your back, and that's one of them.
Sure.
So the other thing is that you want to do it correctly, and we like to use the Booyah stick or some type of stick, like you could use a broomstick or something like this. This is just, to me, a good visual for you. Let's say you don't even do this. Let's just say you think about it. All right, I got the stick here. It's got 3 points of contact. Brad's going to point them out.
Yep, so we're looking at right here, right at the belt line of the sacrum, the mid-back, and the head. And you get this red stick really helps make it a visual for you.
Right. So when you get out of the chair, you want to think of this really helped my wife when I was...
Switch hands once, Bob.
Sure. This really helped my wife because she
much better.
Right away started to... Where's my hand? She right away, when she started getting out of the bed, then she started thinking of like there was a stick in place. That she had to make sure that all the points of contact were there. So we're not necessarily saying take a stick and do it, but
think about the stick being there.
Before the Booyah stick, I used to tell my patients, imagine someone's got a 2x4 taped from your head to your back to your sacrum there, and visualize that. But I think this is even better yet. That the color sticks in.
The other comment you made, Brad, is as having something like attached to your head, a string attached to your head, and pulling you up.
Right.
So you're coming straight up like this instead of going forward like this.
Right.
Now, the other thing, Brad, you had mentioned is it's important to slide forward in the chair.
Right, exactly. It makes a big difference for the mechanics so you get that straightness. And I always have my patients, I'll have them practice before they leave. Make sure you slide to the edge of the chair. You imagine that stick there, and then we're going to use the armrests if they're available to push. And like there's a string on your head, you're going to pull you straight up versus this. Straight up. And if there's no armrest, we talked about this, then you can push off your knees while you're maintaining that nice straight back posture.
When you're in the throes of back pain, quite often what happens, we don't even need to teach people this sometimes, because in order for them to get out of the chair, the only way they found they can do it without having pain is to keep their back just completely straight.
Right. The body's letting you know what to do.
Now, the other point I want to make is that you really want to avoid low surfaces for sitting when you're having back pain,
right?
Especially like bleachers,
right?
And luckily, like this seat right now is too low for Brad,
right? And if you got an office chair, oftentimes they are adjustable, and you may not even be aware of it. But you can see this was really stresses my low back, and I'm going to be much more comfortable at this point, and probably sit at the edge of the chair where I can maintain a good posture. Stools are a great thing if you can just
especially like you can half stand, half sit stools,
right.
the higher stools. And if you are, if you do go to a basketball game or something, or a football game, just go to the upper bleachers, and you can stand up quite often without blocking people's views,
right?
Or stay on the floor and just stand.
I've already done it when my back was sore. Sit on the lower bleacher off to the side so I can easily stand up.
Oh, sure.
And sit down and watch the game. And not getting any people.
And a lot of times you can even take something and raise it up a little bit. They have those cushions that helps a little bit.
Right.
Anyway, it gets you up a
little
little
more
bit.
Comfortable, and it gets you up higher.
So toilet is another issue. They do have raised toilet seats, which if you are having chronic back pain, I think I would get one. They're not expensive at all. You can get them from Amazon.
Right.
And you can get raised toilet seats or commodes that actually have built-in arm rest or arm supports too, so you can push up on those, and they really help. And you mentioned that you had one therapist that would suggest they get onto the toilet backwards sometimes.
Right, so you're actually facing the tank or the wall, and when you do that, you if this is a toilet seat here, you got to get around it. You're facing the wall, and it forces you to have good posture because you can't lean forward.
Right. Plus, you got the tank to hold on to to help lower yourself down.
And that's going to be an individual thing on your body size and how able-bodied you are. If you're older, you have some knee problems, that may not be an option.
You may not be able to handle that.
Right.
But I do find too, Brad, that it does help when I think about when I do my squats and stuff, even as putting your legs quite far apart.
Yeah.
It's easier for me to get further down than going like this.
Sure.
Is if I'm wider apart already and going down.
Exactly.
So even getting out of a chair, you can take that into advantage, put your legs apart a little bit further if you're allowed to.
Right.
So
Sciatica can be annoying, but it is also manageable. Take these tips Bob and Brad have given and adopt them into your everyday life, and you will surely see an improvement. Again, these gentlemen can fix just about anything except for a broken heart, but I think that these physical therapists are doing a lot of good and helping a lot of people. They surely have healed a broken heart or two out there. Let them know in the comments just how much they mean to you all.
Bob and Brad, the two most famous physical therapists on the internet.